palliative care? Is it the oncologist, or is it, how do you get a referral to there?
So it depends a little bit on the palliative care service you're referring to, but almost exclusively you have to have a referral from a doctor. Turns out about 50% of referrals are from specialists and 50% from general practitioners, and it depends a bit on where you are and how much involvement your general practitioner has. I guess within a palliative care service, we see about 70 to 80% of people have cancer, of a variety of cancers, and breast cancer is obviously very high on that, and about 20 or 30% of people don't have any cancer, have a non-cancer illness. So it depends a bit on that. Younger generation oncologists like Rebecca and other people like that who would refer early to palliative care in general, and that's not because they think, oh, this person's going to die soon, but this study, what they did was they referred everyone who came in with lung cancer who's got metastatic disease, who's got disease spread elsewhere. They randomised them to refer as soon as they came into an oncology service versus when the oncologist would normally refer. And it turned out the people referred early lived longer and had better outcomes, such as less depression, less anxiety, better quality of life, and probably died preferably where they were. So in the beginning, a lot of times you're referred because of symptoms. So it could be pain, it could be nausea, it could be vomiting, shortness of breath, fatigue. And as time went on, in the palliative care setting, you would be looking more at psychological issues, advanced care planning issues. So when you look at palliative care from 4 domains, which is physical, psychological, spiritual, and social, in reality, the referral to palliative care can come for help in any of those domains. Now, generally specialists refer for physical domains and are fairly concentrated on that in general, but not always. But then as you go on, other people look at, is there social circumstance? So for example, it could be that a person has expressed, I've got this illness and I know maybe it's incurable. I do want to do some planning for the future. When you refer to palliative care, it's not just the doctor, usually it's a whole access to a nurse. Hopefully it's other allied health who can help out. Every service is different though, but generally we would see that as part of what we could help provide.